Many people over the age of 60 start noticing sudden, painful rashes that appear on one side of the body. These rashes are often accompanied by a burning or itching sensation, which can feel like a strange and uncomfortable experience that seems to pop up out of nowhere. The rash typically begins as small red patches that quickly turn into blisters, and the pain can sometimes be intense. These rashes often appear along the path of a nerve, usually on the chest, back, or face. Now, when you first see this rash, you might think it's just another sign of getting older, a normal part of the aging process that we simply have to deal with as our bodies change. It's easy to dismiss it as just one more thing that happens as we age. But as surprising as it may sound, this rash may not just be something that happens with age. In fact, it could be a sign that something more serious is going on. That rash could actually be a symptom of shingles, a viral infection that primarily affects older adults. Shingles is caused by the same virus that causes chickenpox. After you've had chickenpox, the virus lies dormant in your nervous system, and years later, it can reactivate, leading to the painful rash. Understanding shingles and recognizing its early signs could make a big difference in how quickly you can get treatment and avoid serious complications. Early treatment can help you manage the pain, prevent long-term issues, and even speed up recovery. So if you notice this rash, it's important to pay attention and take the right steps before it gets worse. Hello, I'm Dr. Robert Miller, and I've spent over 20 years caring for older adults just like you. In my years of experience, I've seen how often shingles can go unnoticed or be mistaken for something else. Shingles is a painful rash that develops when the chickenpox virus, which you may have had as a child, reactivates in your body. Even if you don't clearly remember having chickenpox, the virus stays dormant in your nerve cells after you've recovered from it. Over time, the virus can wake up and travel along the nerves, leading to a rash and pain. The rash usually appears on one side of the body and may look like clusters of small blisters. It can be extremely uncomfortable, and in some cases, it can cause intense burning, itching, or even sharp pain that lasts long after the rash is healed, a condition known as postherpetic neuralgia. As we get older, our immune system naturally becomes weaker. This is a normal part of aging, but it means our body isn't as efficient at defending itself against infections or controlling dormant viruses. In the case of shingles, the chickenpox virus stays quietly hidden in the nerves, but when our immune system weakens, it can no longer keep the virus in check. This causes the virus to reactivate, leading to the painful rash associated with shingles. Shingles is more common in adults over the age of 60 because, as we age, the body's immune response slows down and becomes less effective. This is why older adults are at a higher risk of developing shingles, and it also tends to be more severe in this age group, with stronger pain and a longer recovery time. Shingles shouldn't be brushed off as just another part of getting older. It's actually a warning sign from your body that something is going on with your immune system. Imagine it like a warning light in your car. It's telling you that there's an issue that needs attention. Just like how a flashing light doesn't mean your car is simply aging, shingles isn't just an unavoidable result of aging. It's a clear signal that your immune system isn't working as well as it should, and the virus that's been lying dormant in your body is taking advantage of that weakened defense. Rather than just accepting it as another sign of growing older, it's important to recognize that shingles is a wake-up call for your health, signaling that your body needs a little extra care and attention. Your immune system is like your body's personal army, always on the lookout for germs and harmful invaders. It works 24/7 to protect you from infections and diseases. When you have chickenpox as a child, your immune system responds by fighting off the virus. However, it doesn't fully get rid of it. Instead, the virus hides deep inside your body, specifically in your nerve cells. This is because the virus is quite clever. It can survive in a dormant state for years without causing harm, waiting for the right conditions to reactivate. As you get older, your immune system naturally begins to weaken. This is a normal part of aging. Your immune system becomes less efficient at fighting off new infections and controlling dormant viruses that have been hiding in your body for years. This slowdown makes it easier for viruses like the chickenpox virus to reactivate. When this happens, the virus can travel along the nerves, leading to a condition called shingles. Essentially, your immune system, which would normally keep the virus under control, isn't as strong anymore. This is why shingles is much more common in older adults, especially after the age of 60. Once the chickenpox virus reactivates, it doesn't just stay quietly in the background. It begins to move along the nerve pathways toward the skin. This is when the painful rash starts to appear. Typically, the rash shows up on one side of the body, often in a strip or line, because the virus travels along a specific nerve. The rash can be accompanied by other unpleasant sensations, like a burning feeling, itching, or sharp stabbing pain. In fact, the pain can be so intense that it often feels like your skin is being burned or painfully tingling. The reason it hurts so much is that the virus directly affects the nerve endings in the skin. These nerve endings are responsible for sending sensations like pain, touch, and temperature to your brain. When the virus interferes with them, it can cause long-lasting pain even after the rash clears up. This pain, called postherpetic neuralgia, can linger for weeks, months, or sometimes even longer, making shingles a challenging condition to deal with. Shingles can start off in ways that are easy to miss, but understanding the early signs is important. One of the first things you might notice is a burning, tingling, or itching sensation on just one side of your body. This feeling can be uncomfortable, almost like your skin is being lightly touched by something hot or irritated. It's often a sign that the virus is waking up and moving along your nerves toward the skin. The sensation might not just be on the surface either. It can also feel deeper, like something is pulling or aching under your skin. This discomfort can be on the torso, face, or neck, which are common areas for shingles to appear, but it might also happen anywhere along the path of the nerves. For many people, this is the first sign of trouble, even before any rash shows up. As the virus continues to spread, you may notice a rash starting to form. At first, the rash will often begin in a small area and gradually spread over time. This rash is different from other rashes you might have experienced in the past. It's typically confined to one side of the body, meaning it doesn't cross over the middle, so it may appear as a line or patch on just one side of your torso, face, or neck. The rash can be red and inflamed at first, but it soon develops into fluid-filled blisters. These blisters can be very painful, especially if you touch them. After a few days, the blisters may begin to dry up and form scabs. The healing process can take several weeks, but during this time, the pain and discomfort often continue. What's important to note is that the pain or sensitivity can sometimes happen even before the rash fully appears. This early pain, which may feel like a sharp ache or deep soreness, can be one of the most confusing symptoms. It might seem like a muscle strain or even an issue with your nerves, but when it's combined with the later appearance of the rash, it becomes clearer that shingles is the cause. These symptoms can vary from person to person. Not everyone will have the exact same experience, and the rash may not always follow the typical pattern. However, if you notice pain, burning, tingling, or itching on just one side of your body, especially if it's followed by a rash, it's important to get medical attention. Ignoring these early signs can lead to a longer, more painful recovery. And there's also a risk of complications like postherpetic neuralgia, which is a form of nerve pain that can last long after the rash is healed. When you visit your doctor with symptoms of shingles, the first thing they'll likely do is ask you about the specific symptoms you've been experiencing. They'll want to know details like when the pain or discomfort started, where it's located, and how severe it feels. Understanding your symptoms helps the doctor get a clear picture of what's going on. They may ask you if you've had any burning, tingling, or itching sensations on one side of your body and how long you've been feeling them before the rash appeared. They'll also check to see if you've noticed any unusual skin changes. Once the doctor has a clear idea of your symptoms, They'll carefully examine the rash. In many cases, a simple visual inspection of the rash is enough for the doctor to suspect shingles. The appearance of the rash, especially if it's a band or patch on one side of the body, often on the torso or face, can provide strong clues. The rash typically starts as small red spots, then turns into fluid-filled blisters. This unique pattern is very characteristic of shingles, and doctors are well trained in recognizing it. In some cases, the doctor may ask about your medical history, including whether you've had chickenpox in the past. This is because the chickenpox virus, varicella-zoster, stays dormant in the body after the initial infection and can reactivate later in life to cause shingles. If you're unsure whether you had chickenpox, the doctor will consider other factors such as age and your medical background to make a more accurate diagnosis. If the doctor is unsure about the diagnosis or wants to confirm that it's shingles, they may perform a swab test. This involves taking a small sample of fluid from the blisters to test for the virus. The swab test can provide a definitive answer, especially if the rash is in an unusual location or if there's any doubt. While this step isn't always necessary, it can help confirm the diagnosis if the doctor needs more certainty. Additionally, your doctor may recommend a simple blood test. This blood test isn't specifically for shingles but can help rule out other conditions that might be affecting your immune system. For instance, it can check for signs of weakened immunity, which might make shingles more likely to occur or make it harder for your body to recover. Blood tests can also be helpful if you have other symptoms that might suggest an underlying health condition that's impacting your immune system, such as diabetes or autoimmune diseases. By checking for these factors, your doctor can ensure you get the right treatment and take appropriate steps to help manage your shingles and any related conditions. Managing shingles begins with controlling the pain. Shingles can be incredibly painful, so one of the first steps in treatment is to make sure you're as comfortable as possible. Pain control is critical, especially since the pain can sometimes be intense. To help with this, doctors often recommend antiviral medications. These medications are important because they help reduce the severity of the illness and speed up the healing process. The sooner you start these medications after the rash appears, the better the outcome. Starting them early can help reduce the duration of the shingles outbreak and lower the risk of complications like postherpetic neuralgia, which is a long-lasting pain condition that can persist even after the rash is healed. So, if you suspect you might have shingles, it's important to see your doctor as soon as possible to get treatment started. Besides antiviral medications, there are other lifestyle strategies that can help with managing shingles. Rest is one of the most important things you can do. Your body needs time and energy to fight off the virus and heal, so be sure to take care of yourself. Staying hydrated and eating a balanced diet can also support your immune system. While shingles itself can be very painful, managing stress and avoiding triggers that could make you feel worse will also help you recover more effectively. A calm, supportive environment can make a big difference in how quickly you heal. The main treatment for shingles involves antiviral drugs. Common antiviral medications like acyclovir, valacyclovir, or famciclovir are frequently prescribed. These medications work by limiting the spread of the virus and helping it heal faster. They don't cure the virus, but they can reduce the severity of the symptoms and the duration of the outbreak. If these medications are started early, they can help prevent complications and reduce the likelihood of severe pain later on. It's important to follow your doctor's instructions closely when taking these medications to ensure the best possible outcome. In addition to antiviral medications, your doctor might recommend pain relievers. Over-the-counter options such as ibuprofen or acetaminophen can help reduce pain and inflammation. For more severe pain, your doctor may prescribe stronger medications or even opioids on a short-term basis. Sometimes topical treatments are recommended as well, such as creams or patches that can help soothe the skin and reduce itching and discomfort. These can be especially helpful for managing the burning sensation and itching that often accompany the rash. Even after the rash heals, the pain from shingles doesn't always go away. This is because the virus affects the nerve endings, and sometimes the pain can linger long after the skin is healed. This lingering pain is known as postherpetic neuralgia, PHN, and it can be a frustrating and difficult condition to manage. PHN occurs in some people with shingles, especially those over 60, and can last for months or even years after the initial outbreak. If you develop postherpetic neuralgia, your doctor might suggest special medications to help manage the pain. These medications might include antidepressants, anticonvulsants, or even topical pain relievers that can target the affected nerves. In some cases, nerve blocks or other advanced pain management techniques may be recommended. Physical therapy and techniques like TENS, transcutaneous electrical nerve stimulation, can sometimes help reduce the pain as well. The goal with PHN is to find a treatment plan that works for you to minimize discomfort and help you regain your quality of life. Shingles is a condition that can vary greatly in terms of severity and duration, but with prompt treatment and effective symptom management, many people can recover fully. It's important to follow your doctor's recommendations closely and to stay in touch with them throughout the process, especially if you're experiencing prolonged pain or other complications. If you suspect that you might have shingles, taking the right steps early on can make a big difference in how quickly you recover and how severe the outbreak is. Here are a few important actions you can take. One of the most important things you can do if you think you have shingles is to see your doctor as soon as possible. The sooner you start antiviral treatment, the better. These medications work best when they are started within 72 hours of the rash appearing. Starting treatment early can help reduce the severity of the outbreak, shorten the duration of symptoms, and lower the risk of complications, such as persistent nerve pain, postherpetic neuralgia. By getting medical attention quickly, you're giving your body the best chance for a smoother, faster recovery. Even if you're unsure whether it's shingles, it's better to err on the side of caution and seek medical advice early. Taking care of the rash is another important step. Shingles can be very contagious, especially in the early stages when the blisters are present. To prevent spreading the virus to others and reduce the risk of developing a secondary infection, it's essential to keep the rash clean and dry. Wash the affected area gently with soap and water, and then pat it dry with a clean towel. Avoid scratching or touching the rash, as this can introduce bacteria into the skin, increasing the risk of an infection. Scratching can also make the pain worse and slow down the healing process. To help keep the rash from getting irritated, try wearing loose-fitting clothing made from soft fabrics. If the rash is in a sensitive area, like the face, you may want to avoid wearing makeup or anything that could rub against the skin. Even if you don't have shingles right now, getting vaccinated against shingles can significantly reduce your chances of getting it in the future. Research has shown that the shingles vaccine can reduce the risk of developing shingles by more than 50%. And if you do get shingles after being vaccinated, the severity of the disease is often much less. For seniors, especially those over the age of 60, the vaccine is strongly recommended. This is because, as we age, our immune system naturally weakens, and we become more susceptible to infections like shingles. The vaccine helps to boost your immune system, making it better prepared to prevent the reactivation of the chickenpox virus. Talk to your doctor about getting the shingles vaccine, especially if you haven't had it already. It's a proactive way to protect yourself against the pain and discomfort of shingles later in life. Before making any decisions about your treatment or medications, it's very important to consult with your healthcare provider. This video is meant to provide general information and help you understand shingles better, but your doctor is the best person to guide you based on your unique health situation. Everyone's body is different, and only your doctor can give you advice tailored to your individual needs. They can help you decide what treatments are right for you, whether that's antiviral medications, pain management, or other forms of care. Always remember, your healthcare provider is there to support you in making the best choices for your health. When you visit your doctor, it's a great idea to take an active role in your healthcare. This means asking the right questions to make sure you fully understand your condition and the steps you need to take. Here are some helpful questions to ask if you think you might have shingles. Could this rash be shingles, or is it something else? It's important to clarify whether the rash you're seeing is indeed shingles, or if there could be another cause. Sometimes, rashes can look similar to shingles, but are caused by other conditions, so asking this question helps your doctor rule out any other possibilities. Should I be tested for the chickenpox virus? Since shingles is caused by the reactivation of the chickenpox virus, it might be helpful to ask if testing for the virus is necessary. This is particularly important if you're not sure whether you've had chickenpox in the past. A simple test can help confirm if the virus is the root cause of the rash. Could there be a stronger risk of complications because of my age or health history? Seniors are more likely to experience complications from shingles, so asking about potential risks due to your age or medical history is essential. Your doctor can help assess whether your immune system is weakened or if you have any other conditions that might affect your recovery or make the illness worse. These questions are important because they ensure that you're taking an active part in your healthcare decisions. It's always a good idea to voice your concerns and make sure your doctor is aware of your health history. By doing so, you can ensure you're receiving the most appropriate care for your situation. Recognizing shingles early and seeking treatment right away can truly make a big difference in how you recover. When treated promptly, shingles can often be managed effectively, and you can avoid more serious complications such as long-lasting nerve pain. Starting antiviral medications early can help speed up healing and reduce the pain associated with the rash. In many cases, if caught early, you can get back to your normal routine more quickly and with less discomfort. It's important to remember that shingles is not just a normal part of aging, and it doesn't mean that your body is failing. Instead, it's your immune system signaling that it needs some extra help. As we age, our immune system naturally becomes weaker, which is why conditions like shingles become more common. But by staying informed, asking the right questions, and taking action when you notice symptoms, you can ensure that your body gets the care it needs. If you found this video helpful, please consider liking, subscribing, and checking out our other videos on senior health topics. Staying educated about your health is the best way to stay proactive and ensure a happy, healthy life as you age. Take care, and I'll see you in the next video.